Hi guys, welcome back to the channel. As earlier promised, we are starting a new series where we get to scrutinize and review the medical scenes in movies, especially our Nollywood movies. And trust me, this one is going to be super fun, educative and super entertaining. So strap on your seatbelt for a spine-tingling, knee-buckling adrenaline ride. Now, the general idea for this series is to contrast what is shown in movies with what obtains in real-life hospital settings. That way, people have a balanced perspective on how things really work, and hopefully, they also get to learn one or two things in the process. Please, I want to emphasize this very important point. This series is strictly for educational purposes, and we are not in any way trying to undermine or discountenance the hard work of our movie producers and directors. Having said that, let's get into our very first movie. It's a movie called Pant Doctors, produced by Onyeka Okpeze and features actors like Sylvester Madu. Let's take a look at a clip and then we'll be right back. So guys, I don't know if you noticed, but the stretcher the nurses used to carry the patient had no backrest, which is strange because it must have been very uncomfortable or even painful for the patient. Usually, a stretcher should have a backrest which serves as a cushion to support the weight of the patient. In fact, ideally, the backrest should be adjustable because there are some medical emergencies that require, emergencies like heart failure, that require that the head of the patient should be lifted slightly above the rest of the body when they are lying down. With an adjustable backrest, you can be able to manipulate the head of the patient and tilt it upward and forward so that they achieve that objective. Secondly, they are laying the patient face down instead of laying him on his back, which is also strange because typically you want to lay the patient on his back so that you can see and read his face clearly, except for one or two cases which I will explain later. You see, there are some times when a patient may not be able to talk when something is causing them excruciating pain or discomfort, but they can squeeze their faces in response to pain, which lets the doctor or caregiver know that the patient is in pain. Putting the patient face down defeats that purpose. Also, you want to make it very easy for the patient to breathe, especially if he or she is unconscious and cannot turn their neck sideways to free their nose to take in oxygen. That said, there are a few times when laying the patient face down on a stretcher is ideal and sensible. For example, if someone is stabbed in the back with a biro or spoon, or let's even say that the person's anus has been breached and he or she is in serious pain, you can lay the patient face down or on their belly so that you don't put pressure on the injured part and worsen the patient's pain or injury. Let's go watch another scene and I'll be right back.
He didn't say God, he didn't smoke another. Bah, bah, bah. When I music.
Honestly, when I watched that particular scene, I laughed out so loud, Like, who does that? Of course, I understand that the movie is portraying Dr. Bobby and his friends as bad and unprofessional, but still, there are some things that are just far off the mark and unbelievable. That scene is an unbelievable one. Now, I am not saying that some doctors don't smoke weed though. That's not what I am saying. There are doctors who smoke weed. The issue here is the fact that you are smoking it while on duty or within the hospital premises. You dey craze? Apart from the fact that smoking it within the hospital premises puts the patient at risk of inhaling the fumes and also defeats our goal of anti-smoke campaigns, the weed can impair the doctor's judgment and make him prone to committing fatal clinical errors. Any doctor who smokes weed or drinks alcohol while on duty is a very dangerous doctor and deserves to have his or her license revoked.
You can't just start by giving them injection. I think first we have to clean up these wounds. Yes. Ayo. Where is Priska?
She's in the other ward, sir.
Okay. You have to get her so both of you can dress these wounds, yeah?
Okay, sir.
So guys, In real-life hospital settings, when a road traffic accident patient is brought into the emergency, one of the things you want to do as the attending doctor on call is to immediately identify any life-threatening injuries. So you want to quickly assess the patient and make sure that he or she is breathing fine and also not having any serious external or internal bleeding. And this will usually require exposing and taking off some of the patient's clothes for proper assessment. Now, if the patient is bleeding, you want to quickly secure hemostasis. That is, you want to arrest the bleeding. And sometimes if the patient has already bled a lot, or if you anticipate that they are going to lose a lot of blood before hemostasis is secured, you want to have some pints of blood ready for transfusion. Otherwise, the patient can bleed to death right before your eyes.
So dangerous, we so dangerous. My whole entire
Again, doctors don't drink while on duty, guys. Just imagine operating on a patient while you are high to stupor, or you have to pee every 10 minutes because of the alcohol in your system. Or more, dead body goes surplus.
Dr. Gyamde and Dr. Bobby, the situation is critical. No one has Bayo's number, and there is no way we can save those guys without either consulting a Bayo or a Emeka.
See, if we can't get through to them, why don't we go online and browse how to treat accident victims?
You see, guys, it is not an uncommon practice for doctors to sometimes seek advice from other doctors, medical textbooks, or even from reputable online sources. We do this all the time, and it is not a problem at all, as long as the patient benefits from it. However, if the patient's condition is critical and clearly beyond the scope of your expertise or experience, you don't want to keep the patient with you longer than necessary. If the patient is brought to you unstable, try to stabilize the patient and then refer the patient immediately to a facility or doctor with the expertise to manage the patient appropriately. Otherwise, if such a patient dies in your care because you failed to refer him or her on time, they will sue you, they will sue your father and your mother. As they say, while a good doctor does no harm, a great doctor is the one that knows exactly when to refer. And that will be all for today, guys. Thank you so very much for watching. Please, if you like this new series we just started and would love to see more of it, kindly drop a comment in the comment section below, and don't also forget to like, subscribe and turn on your notification for more posts. Sensational.